is Madison Surgeoner. I'm going to be doing a mini bag infusion, demonstrating a mini bag infusion. So the first thing I'm going to do is I'm going to check my medication administration record, or my MAR, against my doctor's orders to make sure it has been transcribed properly. So this one has, so I'm safe to use this. I'm going to check my MAR against my vials. So I have right patient, Fiona F, I have right drug, Vancomycin, I have right dose, 500 milligrams, it's a 1 gram vial, and 500 milligrams is the safe dose as per my monograph. I'm going to check what right route, IV, this is an IV vial, so we are good, and right time and frequency, which would be right now. So this is correct, so those are my 5 rights. I'm also going to check my monograph as well, so this can be administered by a student nurse. This is a safe dose for this patient. I've double checked that. It is a right maximum single dose as well, 3 grams, and we're only giving 500 milligrams, so that is safe. I'm going to double check to see what supplies I need for my reconstitution. So for 1 gram vial, which is what I have here, I need 20 milliliters of sterile water. So I have 2 vials of sterile water here because I cannot grab a mini bag of sterile water. I'm going to use those ones. So I've checked that. I've checked to see what's running in my primary to make sure that it is compatible. And as for my monograph, my drug is compatible, so we are good there. I'm going to grab all this. I'm also going to double check my expiration dates on all these and my patient's allergy. So my allergy morphine, so there's no indication towards vancomycin. I'm going to check the expiration dates. We are good. Check the expiration date on here, also good. So now I'm going to swab my container, or swab my vials. So I would swab for 30, dry for 15. For time's sake, I'm not going to do that, but in real life application, I would. Okay, so swab for 30, dry for 15. While those are drying, I'm going to swab the last one. Swab for 30, dry for 15. Good. So I'm going to, using butterfly technique, I'm going to set up my syringe. And so I need to pull out 10 milliliters of sterile water for from each vial here.
My patient might have, and I've selected normal saline as their current running line is normal saline, so that's not happening there. So I'm just going to set my mini bag
So being careful to keep my hands off the plunger as much as possible. Also, not introduce any bacteria or anything into my drug. Get rid of all my extra bubbles. And make sure I have the correct amount of solution here. So we're good. I'm going to recap. Actually, so because I've not touched the top of this, I know it's safe for me to put my solution in here.
Finish my label here.
Good, so I'm going to let some of the air come back out.
And it has a final concentration in the bag now. 0.5 milligrams per milliliter as 50 milligrams divided by my final volume.
So I'm going to scoop this to keep sterility and promote or reduce stick poke injuries. Do this one as well. I know I've not touched the top of this vial. If I was concerned about touching the top of this vial, I would just swab it again just to be safe.
First time she's receiving the medication, and I just want to have enough time to react to something. So I will just stick with the label.
I'm also going to get rid of all the bubbles in here as well.
Mini bag, and then I will prepare to enter my patient's room. So I'll bring my mark, my pen, my tape label, my 2 bags, the application, some bubble swabs,
A little bit extra.
and that should be all I need. So
I'm going to put any bubbles I have in here, just double check my amount.
and today I will be your student.
So we are good there. I have another 10 that I'm going to inject in here. I have not touched the tip of this container either, so I know that it's safe to use this one.
Upon entrance, I would just do an entrance safety check. So I make sure the bed's low, the call bell is close, the side guys are up, everything on the floor.
Alright, so I'm going to recap this again. I'm going to mix my vial in between my hands. Just not introduce too many bubbles here, and just roll it like this. I'm going to check and make sure that everything is dissolved. Everything is dissolved in here, so it is safe to give. So I'm now going to pull up the dose that I need. So for this drug, I need 10 milliliters. I need 500 milligrams dose. So as per my math, I need 10 milliliters of solution. You can also see my flow rate on there, which I have already calculated. So I'm going to pull back 10 milliliters on my syringe.
So I'm just going to do my third check.
I'm going to re-swab this again before I inject. Keep sterility.
50 milligrams of So I know that my So a little bit about this medication. It's methylprednisolone.
While I'm doing this, I'm going to talk about why I'm giving this drug to this patient. So I have Fiona F here. She came in with a cat scratch and now has cellulitis. So we're giving her Vancomycin, which is an antibiotic for her cellulitis. So that's why we're giving her this drug. So now that I've done that, I'm going to put my label here, and I'm going to perform my second check before I do anything else. So I have Vancomycin, right drug. I have right patient, Fiona F. I have right dose, 50 milligrams. As for my math, I need 10 milliliters, and I have 10 milliliters in here.
So, Emma, so today this is your first time getting penicillin because...
So I have right dose, I have right route, IV, and as for the monograph and my vial, this will be given IV. And then right time and frequency, which will be right now every 12 hours. So I'm good to put this into my mini bag. So as for my monograph, which we talked about before, I need to grab for a 50 milligram dose, I need a 100 milliliter mini bag of normal saline. That's what I have here. So I'm just going to check the integrity of my mini bag. It's good. I'm also going to see if there's any particles or anything like that. No leakage, so we are safe to use this. I'm going to swab my container. So swab for 30, dry for 15 again. I'm going to inject this. Be careful not to perforate the mini bag. I'm going to inject this into there. I'm going to scoop this, and I'm going to put this into the sharps container. I'm going to put my label on here right away. Good, and I'm going to invert my mini bag a few times just to make sure my mixture is dissolved in there. So now that I have this, I'm ready to go to the patient's bedside. So I'm going to grab my tubing. I'm going to grab my label for my tubing. I'm going to grab some alcohol swabs and my MAR to go to the patient bedside. I'm also going to put this in the sharps container just to waste it properly. So now I'm going to go to the patient's bedside. So I'm going to knock and enter. Hi, my name is Maddie. I'm going to be your student nurse today. I'm going to do an entrance safety check, perform some hand hygiene, and I'm going to go to the patient's bedside and check their needs. So can you tell me your full name? Awesome. And your date of birth? Perfect. And do you have any allergies? Okay, awesome. I'm also going to check the IV site and palpate that right now, just to assess for any irritation, inflammation, or anything that I need to know. The patient doesn't complain of any pain or anything, so we're okay. I'm going to check my bag. I'm also going to check the tubing to make sure that this is expired at all. So we're good to use this. Check the bag and make sure it's the right bag that I checked my monograph for. It is, so we're good that. And it is running at a safe rate for the patient. So I'm okay to go do my second or my third check now. So I have right patient, right patient, right patient. I have right drug, Vancomycin, Vancomycin. I have right dose, 500 milligrams, 500 milligrams. I have right route, IV. A right time and frequency, which will be right now. So my third check is good done, and I'm good to give this drug. So I'm just going to give the patient some education now. So we're going to be giving you your Vancomycin because you have that cat scratch on your arm, and it's kind of caused a little bit of inflammation and an infection in your skin. So this is an antibiotic to kind of help with that. Some signs and symptoms that I want you to monitor is any dizziness, nausea, vomiting, any irritation at your IV site is something that we want to know. So if you experience any of that, just let us know, okay? Is it okay if I give you this drug? Awesome, thank you. So now I'm going to set up my tubing. I'm going to put my label on afterwards. But keep sterility.
So, I'm going to
use the port before the pump so that the pump can administer this dose correctly. And is in control of the dose here, so I'm going to swab my port. So swab for 30, dry for 15.
3 milliliters of
Take this off.
mini bag.
And be careful to not touch anything. Set up my tubing there. Good. Before I do this, I'm just going to attach my line here. And also, before I forget, attach my label for my tubing. I'm going to prime my line now by lowering this below the level of the mini bag. I've also already checked before I attached this that this clamp was closed so I didn't lose any drug or anything like that. I'm going to open this up. Yeah, it's 11:06. There we go. And make sure that this bag, the tube here, is filled up halfway. So once it is halfway, I'm going to check to see if I have any bubbles in my line. I do not, so we are good. I'm going to set up my pump. So as per my math, which I've already shown, which I can show you again, I want my flow rate to be 210 milliliters per hour because this needs to be given within a half an hour as per the monograph. So I'm going to set that up. So I need 220. My volume to be infused is 110 milliliters. I want to call back because I want to come back and check on the patient in a little bit. So I'm good to confirm it. I'm going to make sure that everything is open down the line to make sure that the patient gets the drug that they require. So we are good there. I can confirm my secondary and make sure it's running. And I'm going to watch for 3 drips in my chamber here. There we go. I have 1, 2, and 3. So I've seen my 3 drops, so I know my patient is getting the right dose. I'm going to document that I have given this drug in what time. So I've documented that. I'm going to just let the patient know that I'm going to come back in a half an hour. If you have any of those side effects or anything that we know talked about, let me know, as well as I'm going to check to see how your cellulitis is doing and see if the redness and the erythema has gone away. So other than that, I'm going to do an exit safety check. Tubing is lined, everything is good, and I'm going to leave the room.